Okay, hi everyone. Let's get started with our second unit of the Fluency Disorders course. This is going to cover characteristics of people who stutter as well as the ABCs of stuttering. The characteristics of people who stutter information comes more from the first chapter in your textbook, whereas the ABCs of stuttering comes from chapter 2. But let's talk first about the characteristics of people who stutter. About 5% of the population has stuttered at some point in their lives, but only about 1% of these people go on to experience chronic, lifelong stuttering. So 4 out of 5 children who begin to stutter will outgrow it. And as we'll see later on in the course, this statistic can have important diagnostic and therapeutic implications. In this course, we're focused on developmental stuttering, or the kind of stuttering that begins in childhood and that can persist into adulthood. Most developmental stuttering occurs between the ages of 2 and 5, with an average onset of just under 3 years of age. Girls tend to begin stuttering earlier than boys, and it's important to note that severe stuttering tends to occur closer to ages 2 and 3 than to ages 4 and 5. Developmental stuttering can begin suddenly or gradually. Sometimes stuttering may appear to start around times of stress in a child's life, such as a move or the birth of a new sibling. But sometimes no such stressors appear to be associated with the onset of stuttering. And I want to emphasize here that stressful situations by themselves don't cause stuttering. They may act as an environmental trigger if the child is predisposed to stuttering, but parents and life events do not cause stuttering. We'll talk about this more in our theories chapter, but be aware that parents can carry major guilt for their children's stuttering. So it's important that you're able to assure them and reassure them that the child's stuttering is not their fault. One of the predisposing factors to stuttering is whether there is a family history of stuttering. We know that genetics can play a role in whether someone will stutter, and over years of research, we found some interesting facts. Let's say, for example, that a brother and a sister are born to a parent who stutters. The brother will be more likely than the sister to stutter. If both siblings show signs of developmental stuttering, the sister is more likely to outgrow her stuttering as compared to her brother. And if the parent who stutters is female, the son is that much more likely to stutter. This is because stuttering genes in females must be especially strong in order for stuttering to manifest itself in the first place and to be passed on to children. On a related note, you may think that the child of a parent who stutters severely is more likely to develop stuttering as compared to the child of a parent who stutters only mildly. But this doesn't appear to be the case. Overall, we know that about 15% of all first-degree relatives of someone who stutters will also stutter. This means that genetics can contribute to developmental stuttering, but is probably not the only cause of stuttering. There are relatively few differences when it comes to the personality of people who stutter and people who don't stutter. People who stutter on average are as intelligent as people who don't stutter, and they are not emotionally impaired or less well-adjusted than people who don't stutter. There are also some interesting temperament studies which have found that children who stutter are more sensitive to their environments, among other factors, but we're still researching how temperament and stuttering are related. There have been studies which have found that phonology and language skills of children who stutter may be disordered, though this is certainly not true for all children who stutter. We do know that the brains of people who stutter function somewhat differently from people who don't stutter. In people who stutter, the right hemisphere may be overactive and prevent the left hemisphere from processing speech as it should. Just be careful, on a side note, that when you're explaining the concept of brain differences to parents of children who stutter, that you don't imply that their child is brain damaged, because this is not the case. So just be careful to emphasize that point when talking with parents of children who stutter. So, having identified the characteristics associated with stuttering, let's move on now to a discussion of what your textbook author calls the ABCs of stuttering. Recall from your reading that stuttering involves affective or emotional components, behavior or behavioral components, which relates to stuttering, and speech-related components, basically what somebody does when they speak if they stutter, and cognitive components. We'll take a closer look at these aspects of stuttering, as each has really important implications for the holistic treatment of people who stutter. So first we begin with the affective components of stuttering. Recalling Sheehan's iceberg analogy will help to frame this discussion. So remember that the speech characteristics associated with stuttering are only the tip of the iceberg. The internal emotional reactions of people who stutter to their speech can be far more devastating to people who stutter than the actual speech disfluencies. Anger, guilt, and shame are commonly experienced by people who stutter. As speech clinicians, we must be able to help our clients who stutter to take an objective look at their emotional reactions to stuttering. Grieving for lack of typical speech fluency is also common for people who stutter and parents of children who stutter. Our clients may experience the stages of grief such as denial, depression, anger, and hopefully eventually acceptance of stuttering. But it's important to note that the stages of grief aren't linear, and that our clients often may regress to an earlier stage of grief at difficult times in their lives, even if they generally accept and manage their stuttering quite well. The B part of the ABCs of stuttering involves the behavioral aspects of stuttering. I've listed some of these behaviors for you on the PowerPoint, and you can see how some of the behaviors, especially those on the left side of your screen, may relate more to how the person produces speech, including the core types of stuttering and how fast they speak. On the right side of the screen are some of the more problematic behaviors that are not necessarily related to the way someone who stutters talks, but rather what they do in reaction to their own stuttering. So things like muscle tension, distracting limb movements, word substitutions, and even avoiding speaking altogether are aspects of the behavioral components of stuttering. It's important to have fluency clients sit down and write up a list of what they do when they stutter. Some of these behaviors may be very telling and may give you a good direction or a good starting point from which to begin therapy. On a related note, as we're talking about behaviors, is what goes on physiologically when someone stutters and how language production influences speech and stuttering. We know that stuttering is a disorder of the timing, integration, and coordination of respiration, phonation, and articulation. We also know that language factors can influence how we produce speech, and subsequently, people who stutter can be more or less likely to stutter depending on what it is that they're trying to say. So for example, people who stutter tend to have difficulty transitioning from consonants to vowels and vowels to consonants. Note that if someone stutters on the word car, like this, car, it's not that they have problems producing the k sound, it's that they can't transition from the k sound to the rest of the word. Okay. And that's a good point to make, because oftentimes we may think that people who stutter have problems producing the sounds that they repeat or that they hold out, and that's not the case. It's really that transitioning to the rest of the word. Longer words and content words that carry more weight also, they receive more linguistic stress, and they're likely to cause someone to stutter more. It's difficult as well for someone to begin to speak and to maintain connected speech, and both of these situations have a lot of motoric and linguistic complexity. So as you think about behavioral aspects of stuttering, don't forget that people who stutter may be more likely to stutter in certain circumstances versus others. And that's depending on what's going on linguistically and also physiologically. And then finally, the cognitive aspect of stuttering, that's the C part of the ABCs of stuttering, relates to the thoughts that people who stutter have about their communication and their stuttering. The bulk of my research has investigated fluent speakers' reactions to people who stutter, and there is a negative bias towards stuttering. So people who stutter have to deal with listener reactions to their stuttering from an early age, and we know that attitudes are shaped over time. So people who stutter learn to have negative attitudes about their speech and about their stuttering. It's really interesting to note, and we should all be aware of this, that everyone talks to themselves, and we all have this internal monologue or this self-talk. And this self-talk is about 75% negative. And only 25% of the things that we say to ourselves or that we tell ourselves is actually positive. And considering that we can think up to 1,200 words per minute, so we think a lot faster than we talk, that's a lot of negative self-talk. And so in some ways we become our own worst enemy because we're constantly berating ourselves or telling ourselves that we should do this or we should do that or we should do these things better. And so this goes double for people who stutter, who may be very critical of their ability to communicate, very critical of their stuttering, maybe critical of listeners. And so what we as clinicians need to do is to measure communication attitudes and the attitudes of our clients towards their stuttering. And some of the ways to do this is the S24 scale for adults and the communication attitudes test for children. That's the CAT. And so one of the most beneficial things a clinician can do in therapy is to educate people who stutter about stuttering and to work on reducing these negative thoughts about speech and stuttering and communication. And finally, to wrap up our discussion of the ABCs of stuttering, I want to emphasize that if you are treating a person who stutters, working on reducing stuttering is only one piece of effective therapy. So you need to focus on thoughts and attitudes associated with speech and stuttering. To better understand these concepts that have been presented here in a very kind of academic or theoretical way, you should definitely watch the video called Transcending Stuttering. This video has people who stutter talking about their journey with stuttering, and it really highlights the affective and cognitive components of managing one's stuttering. So I've provided the link here, but you can also do a Google search for it. So do watch it and enjoy.